This is a product that I like. It's called Dr. Reiter, R-I-T-E-R-S, Reiter's Real Ease. I hope you can see that. I'm filming by myself and I can peek, and yes. Dr. R-I-T-E-R-S, Real Ease. Okay? And this is a cervical device. And in my opinion, it's one of the best for isolating the upper cervical spine. But you can see that curve. It has a little bit of a spring element, and what you do is get your head in there, and it supports it very nicely. It lets your head and neck just creep back into it, and muscles get to take a little bit of a vacation, and it can be very, very relaxing. In terms of using it for exercise, it nicely isolates the upper cervical spine. So it holds the rest of the neck in a fairly normal curve. And if it's comfortable, then you can proceed. If it's not, then don't, okay? The exercise that I like to perform and have some of my clients do in this device are very simple. You can nod yes and no, so head is going up and down, and the movement happens only in my upper cervical spine. It would take a lot of effort to go beyond that, and I would actually have to come out of this device. So we can go yes and no. Okay? Believe it or not, you can actually enhance traction in the upper cervical spine, and it's hard for me to tell you how to do that, but basically you're using muscle power to push up towards the top of your head, okay? And all I can say is you could try it, and someone will say, oh, but you're using muscle and you're trying to relax and you're using muscle, and yes, but as I do it, I assure you it feels therapeutic, and I feel like I'm isolating that area that needs isolation, and yes, I feel it tractioning. So anyway, there's that. And I can't imagine anyone needing to compress it downward, but again, if they do, then that's a possible movement. You can then have them side bend, so that'd be ear to shoulder. Okay, ear comes sideways towards the shoulder, and you can go the other way. Okay, and then you can work on movements of looking over towards the right shoulder, and it really constrains it to those upper two joints, to the best of my understanding, and we go to the left as well. I favor doing very gentle movements, very, very gentle, make them very relaxing, almost effortless, and I suggest up to 30, okay? Now you can also, practice bringing the head straight forward towards the ceiling. I don't like that. My neck doesn't like it, but it really likes the opposite, which is to glide it straight back into this device. So my head is moving straight down like a block of wood, straight down towards the floor. So not only is my chin tucking, but my forehead is tucking at the very same time. Okay? And that's called posterior glide. You can also work on a side glide. So again, block of ice sliding on a table. Okay, so the block of ice is just sliding over to the right. Okay, and you can work on side glide to the left. Okay, and feeling like I'm missing something, you could work on oblique movements, which combine several of these movements together. So you could push northwest, southwest, northeast, southeast, the diagonals. You could do little tiny movements up that way at a 45 degree, or you could name them according to a clock. Say, instead of 12, 6, 9, and 3, then we could go for 4:30, okay? 4:30, and 7 o'clock-ish, give or take, and 11 o'clock, and you get the concept, okay? So again, this is Dr. Reiters real ease. And if you find it helpful, good. Thank you.